Mr. Speaker, I am just with the Prime Minister, and this House believes health insurance should be mandated for all Nigerian citizens. Mr. Speaker, honorable members, I'm sure these three words, health is wealth, are not new to us. These are words we've had in different ways and at different points, and I'll show you that these words are true. As a young man, I had to work three jobs that paid daily to help fend for my family. I couldn't afford to rest and never had health insurance either. I didn't see the need to. I kept running the jobs like Superman, unbowed, unbent, unbroken. Well, until I was bowed, bent, and broken. My ill health cost me many days of work and a lot of money. While health insurance might not have given me back the days lost, it at least would have helped me to save costs. Britannica defines health insurance as a system for financing medical expenses to pay all or parts of health services by means of taxation or other voluntary contributions. Mandatory health insurance is health insurance under an obligatory public scheme enforced by law. People are enforced by law to pay a token depending on how much they earn and enjoy the full benefits of health services. I'll talk about why mandatory health insurance is important, or my Deputy Prime Minister will talk about how we'll make sure it works. Health insurance should be mandated for every Nigerian citizen because it helps to ensure affordability and physical accessibility of health services. According to a research article by John Garvey titled The Financial Protection of National Health Insurance, it revealed that insured households spend up to 82% less of their household income on major health expenditure like surgeries. Mandating health insurance ensures that every citizen enjoys this benefit. The pool of resources gotten can also help in properly equipping hospitals and improving accessibility. Health insurance should be mandated for every Nigerian citizen because the people are willing. A recent survey conducted by the NY Polls, a renowned research organization in Nigeria, revealed that 8 out of every 10 uninsured Nigerians expressed willingness to pay for health insurance. This shows that it is socially acceptable as people are willing to collectively support the health sector, and mandatory health insurance is only a way to ensure that every citizen is involved in this process of national development. Health insurance should be mandated for every Nigerian citizen because it brings us one step closer to accomplishing universal health coverage. Universal Health Coverage (UHC) is the provision of quality health services to all individuals in all communities without suffering financial hardship. According to a 2013 David B. Evans article published in the Scientific Journal of Public Health titled UHC and Universal Access, Financial Affordability, Physical Accessibility and Social Acceptability are important areas of the UHC. This house has shown that mandating health insurance makes healthcare financially affordable. It has also shown that it makes health services physically accessible. Finally, it is already socially acceptable. Evidently, mandated health insurance can only take us one step closer to achieving universal health coverage. Mr. Speaker, members of the opposition, I understand that this is a bold step. However, it is one that must be taken. Health is wealth, and we just might have also found the solution to building a wealthy nation. Thank you, Mr. Speaker.
Mr. Speaker, I am Oluwatoyin Bamiboye, the Deputy Prime Minister, and this House acknowledges that mandating health insurance can be challenging. Even in the presence of overwhelming evidence, the opposition might argue that we are only trying to overrule the National Health Insurance Authority Act passed by the past Prime Minister. This is far from the truth, as we only seek to improve on it. This act ensures that money is paid into a common purse. What mandatory health insurance does is ensure that every citizen contributes to this purse. They might also argue that we have not met the recommended 15% health sector allocation, hence should not mandate health insurance. This will only show that they fail to accept the current reality of things. The Nigerian economy needs urgent revitalization, which we have embarked on, and we are working to meet that mark. However, countries like the United States, with appropriate allocation, still require their citizens to pay for health insurance. We must tailor our policies to our needs, and mandatory health insurance is sewn to fit. The opposition might go on to argue that taxing citizens who are very poor will only make them poorer. However, this will only mean that they do not think as far ahead as we do. Citizens will only be taxed based on their level of income. We will also set an income benchmark below which a citizen will not be taxed. Nigerians who earn below this benchmark will be exempted from the health insurance scheme and will be allowed to register. They can then be offered educational or job opportunities to improve their economic standing, after which they will start paying the mandatory health insurance. This ensures that citizens in overwhelming difficulties are not further overwhelmed. Honorable members and members of the opposition, mandatory health insurance is really like party jollof. Someone is asked to bring some rice, someone else Maggi, and another tomatoes. Regardless of if the ingredients were brought grudgingly or happily, we all still enjoy the meal when it's ready. Compulsory health insurance ensures financial affordability and physical acceptability of health services. It is a giant stride in our leap to the moon of universal health coverage. Thank you.